Today we're going to be discussing one of probably the most controversial topic we've discussed this far. That's not hard to do. But we're going to try to break it into installments because it is a large topic with a variety of different contributing factors for people to discuss.
Yeah, and there's a lot of forks in the roads. You can go down rabbit hole after rabbit hole, and it's hard to find a lot of the information. It's not just widely available. And fortunately for us, we either have friends or have firsthand experience talking to certain physicians that tell us like the inner workings. And you can't really Google some of this stuff.
Yeah, when you can, it's not trivial to find.
Yeah.
For whatever reason, I'm not trying to be tinfoil hat man again, but I do believe that there is a deliberate, in some sense, approach to search engines, filtering and refining what comes up when you type certain things in. I did find papers that kind of show the alternative hypothesis, but it took a lot of digging. But without further ado, the topic we are discussing is vaccines in the context of whether or not there is correlation and causation to autism spectrum disorders. And like we said, it's a pretty complicated issue. There's a lot of ongoing debate. It's even been politicized in recent years. There's probably a lot of discussion about this. People talk about certain entities like RFK is very synonymously talked about in this discussion. We're not going to talk about that as much today. We're going to focus our efforts predominantly on a paper that came out in the late 90s.
It's kind of like the first paper that linked it, or was there hypothesis before this? And was it 1998?
It was 1998 when it was published. This is the infamous Andrew Wakefield Lancet paper discussing potential correlation and causation of the MMR vaccine and autism. I don't know that there could have been preceding evidence for this. I don't know. It's actually
maybe
something to look at. Most of the talk is focused on this paper. This is kind of the origin story, if you will. And after this paper is kind of where we have I wouldn't call it backlash, but there's effects of this downstream where people started forming opinions about anti-vax, which is kind of persisted to today in various capacities. People started questioning whether they wanted to vaccinate their children, and put them potentially at risk of developing certain neurological diseases, including autism. And that into itself, I'll first say, I think that the notion there, or at least the reasoning behind it, I'm okay with, right?
Yeah.
Parents' natural inclination is to try to protect your children. But where this becomes complex is, was the data, was the evidence and the ideas portrayed to them accurate?
Yeah.
A parent is only as good as the information at their disposal, and that's why this is such a interesting and polarizing topic. Kind of going into that, I had to actually look back at what is MMR, what does it stand for, and this is sort of similar to when we were talking about polio last episode. For better or for worse, I actually think for better. We're all better for it. That's not something that, by and large, we have to combat in this era. And again, that is largely attributed to the success of the MMR vaccine worldwide. Measles, mumps, and rubella is what that stands for. They're all viral infections. Measles being one of those three, kind of the most devastating or highest mortality. It can be not a great thing to get. They're all kind of bad in their own regard. I didn't know what that looked like, what it caused. I didn't really know much about it. Did you?
No, I mean, other than like the spots on the skin, it's kind of one of those things. If it's not an issue in your life, you don't know what about.
Right.
If it's not affecting you, it's kind of like,
why do you care?
Yeah, why do you? If it's not a part of your life, you have no idea that it's going on.
I think it's one of those things
problems.
like we've all seen some of the pictures, like either in a health class
or
or
like 10th grade
or something like that, where they're like, "This is what it looks like," and you're like, "Wow, that looks pretty gnarly." And then you kind of go on with your life because you're like, "Well, I was vaccinated. I don't have to worry about it."
Yeah.
But it's still kind of out there in the ether in some regard. That there's a stat here that I have says that before introduction of the measles vaccine, there was an estimated 2.6 million deaths globally per year. Most of this was affecting children under the age of 5.
This is for measles?
This is for measles, yeah. And so that's a pretty alarming number. 2.6 million. That's a lot of.
It was in the 70s or 80s?
It doesn't give a specific timeline, but I believe one of the first measles vaccines did come out in the early 70s, and it evolved from there. They later packed it together with the other two, so you were getting effectively kind of 3 vaccines at once. Mumps also is a viral infection that was less severe, generally speaking, but it could still have some pretty serious complications. A lot of these ultimately could have similar kind of effects, causing problems with the brain, causing meningitis, so inflammation of the brain, spinal cord, encephalitis, inflammation of the brain. At least in mumps, they note other potentials, inflammation of for young boys, testicles. It could affect your long-term fertility, among other things.
Yeah.
Some pretty bad stuff.
I think the biggest thing that alarms me that I didn't know of is the thing that first got introduced by RFK to me, at least, is that these vaccine manufacturers have immunity to lawsuits.
Yeah.
That's the craziest thing ever. If like you create something and it kills people or hurts people, you can't get sued for that. Like the entire ecosystem of the judicial
So I think you're
is like a corrective action.
You're talking about the Vaccine Act of 1986, I believe.
And it's like, had I known that, I feel like most people probably don't know that, and most people, if they buy something, they probably don't think that, like, hey, if this kills me or hurts me, I can't do anything about it.
Right.
And it's so what's the incentive
for people to make something safe and effective?
Right. Well, what does that even? Yeah.
And what does that mean? That was interesting. Similar.
That's the craziest thing. Though. That's still every day that I think about that is just like, how do I get a product that
had that discussion at lunch today with some of our colleagues, and they had no idea. I was like, yeah, neither did I until I looked at it, and it's like part of legislation.
It's like a guaranteed. Mm-hmm. It's like worse than a monopoly.
Yes. Yeah. And so this is kind of get off topic a little bit. We might discuss that further, but if you're not familiar with it, in effect, vaccine makers and distributors up until the mid-'80s were facing lawsuits from individuals who had been harmed by various vaccines in the past and suing them. And the litigation...
Rightfully so, though. If it causes your energy, you inject something and it kills you.
Sure. And you were told it was safe and effective.
Yeah.
And the litigation and kind of the fallout from that was costing them more money than they were making off these vaccines. So they were effectively going bankrupt. And this is, of course, a paraphrasing of it. I'm by no means a law expert. But my understanding was that, vaccine makers and manufacturers went to the federal government and said, hey, vaccines are a good thing. If you want us to continue to make vaccines, right now it's not cost effective. We're going to stop because we are getting sued out the ass. And we can't afford to keep doing it.
Just goes to show how good they were.
Yeah, right. And so they basically came to an agreement that, yes, we'll pass legislation to kind of give you a protective measure so that you won't be sued from these people. And there's actually what are called vaccine courts that came out of that. That kind of now, I believe to this day, I'm not positive on that. I'd have to look at it. Help litigate.
I wonder if the one with Johnson & Johnson that caused blood clots is if they're suing with
You're
that.
talking about for the COVID vaccine?
Yeah, the one that got pulled.
I mean, I don't know. Because
I haven't heard. Well, of course you haven't.
Were you even allowed to sue people?
But
because you signed off on... I mean,
yeah, that's true. You do. You have to sign off on...
I don't know if... I'm sure there are cases out there. This is, again, off topic, but interesting nonetheless. Like, I'm sure there are cases out there where people were hurt by the virus or their family members were hurt by the COVID vaccine.
Well, that's why they pulled the Johnson & Johnson one.
Yeah.
It's like the Joe Rogan, they pulled it before he got it. And
right. I'm sure there's people out there looking at avenues of suing those people and whether or not they were or weren't protected by these.
Right, but this relates to like the vaccine course that you were talking about.
Correct. I don't know. Is there ongoing litigation pertaining to the COVID vaccine? Probably. Yeah. It's kind of a complex thing, which is in itself a little bit scary when you think about it. But yeah, like you said, what's the repercussion to those companies? Nothing. And therefore, what's the incentive to make sure that they're not hurting people? It's not that much. They're more worried about dollars, it seems.
Yeah.
But in any case, so going back to this topic with autism, MMR, it's safe to say that anything that would reduce the amount of measles, mumps, and rubella would be a good thing. Hence why it was implemented throughout the world. And in effect, most of those diseases were mitigated substantially. I'm not going to say eradicated because they weren't. They still exist. But in the United States, for the most part, they aren't as concerning as they once were. We'll get into that a little bit later because of anti-vaxxing ideologies, there have been outbreaks of measles in more recent years. In particular, in places actually I'm familiar with, including the Northwest where I used to reside. It was a big problem in Oregon, especially Portland. We had like epidemics and outbreaks of children in the hundreds, if I'm not mistaken. And this is like within the last 5 to 10 years. It would happen at least once or twice a year because kids weren't getting vaccinated. So this is an ideology, this causation correlation that persists. And while the general scientific consensus is that autism has not been caused by vaccines, you'll find that almost universally everywhere you look, like the big CDC, WHO, any of those are going to formally tell you there is no data to suggest correlation or causation. The idea still persists, and I think it is worth kind of not completely saying that it's crazy.
Right, you should investigate it.
Yeah, and people have, and the data, again, we're not talking about that specifically, but by and large the data seemingly supports that. However, if you get into techniques and the ways that they collected that data, you could probably find some problems with their generalizing the outcomes. But
right, and I think it's like important. People want to know why, and so
exactly.
There has been an increase in vaccination, but there's been definitely an increase in autism. So.
And there seemed to be a kind of overlap, at least in the time period when those started to be seen.
Right. In the 60s to the 80s, it was about 1 in 2,500 children. From the 90s to 2000s, it was 1 in 150. And then now it's
1 in 28 or something like that.
Yeah. 1 in 28, 1 in 54. So, like, how do you go from 1 in 2,500 to 1 in 20?
Right.
What is that? Is that 100-fold?
Well, and we've discussed this before. There's not a real easy way to point at one thing.
Right.
But it is kind of like, well, let's consider the different potentials. Is this one of them? I think possibly, and there's no reason not to at least investigate it, as you mentioned.
But the 100x increase is crazy.
Right, and then you'll have people say, well, we're just better at recognizing it, diagnosing it, etc. which is probably true in some regard, but even then, it seems a little bit high.
Yeah, 1 in 20 kids. Like, how did people survive if 1 in 20 kids had autism? And that's just autism, not like the other things.
Sure. And so, going back to this paper, Andrew Wakefield, by the way, he's before all this, he was a doctor, a medical physician.
Mm-hmm.
He treated patients. He was actually, I believe, a gastroenterologist was his specialty. And where he kind of came to fame was this paper, and people point to that being like, oh, well, he was just trying to make a name for himself. But in effect, this is a 1998 study, Lancet, became significantly controversial. The study suggested a possible association, again, between the MMR vaccine, development of autism spectrum disorder, or ASD. Over time, people criticized him, and subsequent investigations revealed several flaws and ethical concerns. Here are some of the critiques. So his hypothesis was that essentially he observed that these kids that were brought to him, I think there's 12 individual case studies, their parents brought them to him. He investigated their cases. They all had gut inflammation. He sometimes characterized this as colitis. And he thought that perhaps some of the other unnerving symptoms that these kids were going through and displaying, which included behavioral disorders or regression, might have some correlation. And so he was basically proposing the idea that there might be some sort of causal correlation between inflammation in the gut.
Well, between the MMR vaccine to inflammation in the gut to autism.
Right, and that inflammation could have been caused by the MMR vaccine. And largely that is due to the temporal proximity in which these kids developed these symptoms and when they were given the MMR vaccine.
Temporal meaning?
The time.
Yeah.
So it was very close in time. And so one of the big critiques here, before we get into the purely controversial ones, was just that small sample size and the lack of controls, right? He's looking at 12 cases that are kind of anecdotal, right? So small sample size of only 12 children. There isn't a lot of statistical validity of those findings, and you don't have a control group. Other people have looked at control groups, right? Where, thousands, if not millions of kids every year are given this vaccine, presumably, and not all of them go through this. But
that's the thing, even if it's like a 1 in a million, it just sucks if you're that one.
Yeah, and so there's this kind of idea of looking at like global statistics, and you're like, okay, it doesn't cause autism. But how can you really know that for certain, right? How do we know that there isn't, because there is autism, right? And it's difficult. Yeah, and it's difficult to look at individual people and be like, we know for 100% sure that it is caused by you getting that. It's hard. But I think to just say, because statistically, you're looking at global, that's kind of unfair, right? So I understand the critique of the small sample size, but I also think looking at small sample size unto itself isn't necessarily a bad thing all the time if you're trying to go into depth into those individual case studies. That's how we discover weird medicine, medical findings, is like this person might have something very rare. I'm a good example of that. I'm like one of 8 billion people on the planet that has what I have. I'm not going to get into that entirely, but I was told for 30 years. 8 billion? It's very, very uncommon, yeah. I was told for 30 years that it was all in my head and that was crazy.
Yeah, well, 1 in 8 billion, yeah.
But they look at you more in detail and they find something, Who's to say that if you look at these 12 children, they might be that 0.0001% or whatever it is. In any case, where we start getting into kind of the more controversial things is when they started looking at conflict of interest and ethical concerns.
Right, yeah. So we should talk about the criticisms because we need to have a balanced view of things.
So it was later revealed that Wakefield had financial interests in creating essentially a potential alternative to the MMR vaccine
Or test kits.
or test kits. Yeah. So it's kind of twofold. He did not disclose these conflicts of interest in his paper, which is kind of like, I don't know if this is the reason why that's now like standard practice, but definitely anytime you publish a paper, you have to declare, do you have any competing conflicts of interest? There's actually a section
Right.
at the bottom of every publication, at least on the primary paper.
So maybe this he thought was like a gray area.
Maybe he also
lot.
didn't know at that time. I mean, very, very likely, I'm assuming he like wrote this paper, put it out there, and then after the fact started kind of becoming a proponent.
Yeah, it would make sense. You find an issue and then you want to create a solution
So
to that
he might
issue.
not have had conflict of interest at the time he released the data. But nonetheless, people are always going to point to that. Well, he had a motive, essentially, to fabricate or embellish data, right?
So another one is there's been other physicians that try to replicate his data, and it said that they weren't able to replicate it.
Yeah, that's a big one, actually. So,
but I haven't really looked into the replication of it.
Yeah, I mean, what's interesting is you look for that, and all you see is numerous people have tried to replicate his data and failed. But it's like, okay, I haven't read the actual hard literature. I'm not saying it doesn't exist.
Right. That's hard to find, though.
But it like, I want to read the hard literature. And then I also want to look at it not just at these like global statistical level, because a lot of the time they're looking at millions of different children. They're looking at like children and their health insurance claims and stuff like that. And it's like, okay, one, not everyone is going to seek medical attention. Not everyone has insurance.
Right.
You're already kind of biasing your data a little bit, or at least not looking at every possibility there. But yeah, failure to replicate, the inability to reproduce the results raised doubts about the validity of his study. There's also the potential, people accused him of misrepresenting the data altogether. So the study's findings were based on alleged detection of the measles virus in the intestines of the 12 children, right? And that measles virus would have come presumably from the MMR vaccine, and that would have been kind of the causation of the gut inflammation, so on and so forth. Subsequent investigations found discrepancies and inconsistencies in the reporting of that data, also raising concerns of the accuracy and reliability of those results. I don't have a lot to say there other than you gotta guess take their word for it that they weren't able to find reliability, but I don't know. So eventually all these kinds of concerns ultimately led to pressure on the journal itself. The Lancet, by the way, is a pretty well-esteemed journal. And eventually, this is what I thought was interesting. I remember hearing this as a case study when we were going through our doctoral studies as like an example of ethics and publishing and things like that. So it was retracted.
2010.
In 2010.
12 years later.
12 years later. That's a pretty long time for a retraction.
Yeah.
Usually when you have something retracted, it's like blatantly obvious, it's pretty quick. People call you out on that. And weirdly enough, this is a kind of an interesting example, but there was a retraction I remember from 2020. And it was someone very quickly tried to publish a paper, and I think it was out of India, of the genome of the coronavirus and comparing that genome to HIV virus, and claiming that there was genetic similarities which proved, or at least suggested, that coronavirus, responsible for the COVID pandemic, was likely made in a lab. That was in a preprint. It wasn't formally published in whatever, I can't even remember the journal. But as quick as it was like in preprint, it came out and was retracted. Like it didn't even make it to the full publication process. And so that's how quick these days that people are like, no, that's BS. they're not publishing in that. It happens even before it hits the final print. And so it's kind of weird to see this, where it was like, for 12 years, this was out there.
Wasn't that that's a whole different.
It's a whole different thing.
That's a whole different.
I'm just trying to make the point that like 12 years is a pretty long time.
Right.
If you're like that sure that this was, unethical and conflict of interest and not reproducible, why did it take 12 years for you to retract it? Why did it get published in the first place? I guess is a good question.
We could do a whole podcast about that.
The
lab leak theory.
Yeah, we definitely could, but another time perhaps. I'm trying not to get canceled again. No, I'm kidding.
Are we?
I guess, I don't know. In any case, so the general consensus, scientifically speaking, is that there's an overwhelming majority of scientific and medical experts rejecting his claims. Multiple large-scale epidemiological studies have been conducted worldwide, found little to no evidence to link MMR vaccine and autism. As a note of interest, what happened to this guy? Well, he did go on to try to, as we mentioned, sell his own ideas in terms of like alternative vaccines, kits for testing, things like that. He was ultimately, I almost said disbarred, but that's for lawyers. But
what's it called when
his medical license was revoked, so he's no longer able, at least I don't know if it's current, but I'm assuming, to practice medicine. And he was in England. He was a UK doctor, but that's a pretty big deal. Like, he was basically so heavily scrutinized and called a fraud that they don't allow him to practice medicine any longer. Aside from that, kind of societal implications have been, a lot of people have become a lot more hesitant, and I don't want to say rightfully so, but I can see why, to vaccinating their children. And so we've had kind of the rise of what has been dubbed the anti-vax movement. So we have vaccination rates in some areas, including, as I mentioned, in the United States, diminishing, contributing to outbreaks of more or less preventable diseases at this point. And so the other part of this, and one of the reasons we're bringing it up, is the fact that, trust the science, right? This was a trustworthy journal. By and large, we like to think that doctors and medical researchers are trustworthy people. And that to be published and kind of expelled into the world for interpretation, that you've gone through rigorous scientific research with full transparency and, good ethics being conducted to shape kind of our understanding of medicine and also, health policies. And yet, this got published and had massive implications that are still kind of ongoing.
Yeah.
And I think for a lot of people, this was a huge knock on whether the common layman is able to truly trust doctors. That's one of the repercussions. Doctors, scientific literature, it's kind of knocked the credibility a little bit. It was one of the first big ones that really did that. Not terribly dissimilar to some of the things that have happened in more recent years pertaining to COVID and literature and controversies with, publications and stuff like that. But this was a big one. So good example that not all science is good science.
Yeah.
Not all scientists and doctors are, incorruptible, so to speak. We all have potential faults and ulterior motives that could play a role in what we're publishing and why. Biases. And so it does, at very least, provide a lesson for us all to kind of it's okay to be at least skeptical. Again, trust but verify, right?
Yeah.
And that's kind of what happened here is we trusted, or the Lancet and other people trusted before they truly verified. Luckily, people did go on to at least attempt to verify or refute, which is commendable. But yeah, it's definitely one of those eye-opening ones that comes up quite frequently in conversation about not just vaccines, but kind of scientific fraud and concerns over accuracy of data and things like that.
Yeah, I think the biggest thing is just like the reasons to lie or leave out data. It's like you need to report that. It's like, because money will skew a lot of people's judgment. Like, you invest in a stock, you're probably going to buy their product, or you're going to want them to succeed. Like, you buy $1,000 or $10,000.
That's why we're not
Apple.
necessarily allowed to like own stock in the company that we work for.
We're not.
You and I are not.
Oh, we get stock options. When do we get stock options?
Don't worry about it. But yeah, I mean, like, money is a pretty big motive, right? We see this in pretty much all walks of life. Politics and medicine. I think this was a discussion we were having kind of off the record, but we did discuss how physicians do have incentives, actually, to prescribe different medications, to provide vaccinations.
Yeah, that's the crazy thing is I recently had a kid and we're trying to figure out the vaccine schedule. Not only are certain vaccines like mandatory almost, but pediatricians, they get bonuses based on their client base of how the percentage of them that they're vaccinated. And
basically hitting a percentage quota.
Yeah, and when I talked to the pediatrician about it, it's kind of, he never brought it up. I heard about it on a podcast, so I asked him about vaccines in general, and if I didn't want to have my kid vaccinated. His response was, if you don't want this vaccine, then we're probably not a good pediatrician for you, because our views aren't going to align on other things, which is a very politically correct way to say. Maybe that's true, but also at the same time, you're gonna decrease my numbers. I might not hit the bonus.
Blackballing you from getting all medical treatment, know, because you won't sign up and do exactly as they say.
Right, but nowhere in that conversation did he say that, if I have 85 or 95%, I'm not sure what the percentage is of kids being vaccinated.
Nor is he ever going to say that transparently to you. But.
Right, which is, I feel like, is a total conflict of interest. It's like that's not informed consent at all. No,
and I think my opinion is that one of the rights of a person, especially a patient, and we're not in a third world country. We're in a very wealthy country. I know it's a very hot political issue, healthcare. But you should be able to make your own health decisions.
Well, you should know why the physician or doctor is telling you to do this. Right. And I feel like they're lying. They're probably lying to themselves. It's like, oh no, this extra however many thousands of dollars a year that I'm getting paid to have a certain percentage rate doesn't affect my judgment. But there's no way that doesn't affect your judgment. Just because some of the data and studies say that this is safe and effective doesn't necessarily mean that you shouldn't tell your patients that, hey, I'm actually incentivized monetarily to give you this.
Yeah. And not that would change everyone's mind, but at least give you a second to be like, okay, then what's the motive here?
Right. It's a motive. It's a definite motive, and honest, you have to be honest with yourself.
Yeah. I think what's interesting too is that if you're a medical professional, by and large, I'm talking about people who've gone to either physician assistant school or full-on medical school, you've kind of been indoctrinated into a culture that hypes you up a little bit, like that you are the expert. I've seen this as a patient that like sometimes these doctors think they're God's gift. They think they're the smartest person in the room.
Yeah, but we noticed that in grad school, which is
Sure.
professors in general. I feel like the more intelligent you are, the more likely you're going to think of yourself as a god.
Right. And like, but doctors are already in society kind of put on a pedestal. You know, oh, you're a doctor. That means you must be super smart. You're smarter than me. That's why I trust you with my life.
Right.
Right.
You've done all this studying. You've done all this work.
I guess coming from my experience, though, for a number of reasons. One, we're doctors, although we are not medical doctors. This is not medical advice. But like, we both have PhDs, and we firsthand saw that. Okay, we're supposed to be really intelligent, right? I'm not intelligent about everything. Yeah. I've made some dumb decisions, but we've also seen a lot of dumbasses around us that got their PhDs. That just if you tell me you have a PhD, I'm like, cool.
Yeah.
That doesn't mean shit about your intellect or your really capacity to do a job well, in my opinion.
Yeah.
And the same is true for physicians in my experience. Is like I've had good doctors. I've had a couple that I will outwardly say I attribute my life to them. And that's a big high praise, right? But there's been more than not ones that have failed me because they wouldn't listen to me as a patient. When I ask them questions, they're very condescending. If you challenge any of their ideas, they become hostile.
Yeah.
They kind of think, well, what does this guy know?
Yeah.
And a lot of them, I never tell them I have a PhD and that I have, studied not formally, but a lot of medical things. It's part of our job.
Yeah, but you don't even need to have a PhD. You can just look at Wikipedia.
Anyone can read it up. And honestly, what's more disturbing is sometimes I see the doctors do that in front of me.
Yeah.
They're like, oh, what is this? And they type something in Google, and I'm like, you're on Wikipedia. What the hell is that?
Yeah.
But I guess it's just like, it scares me that you have these people that we're putting so much power and faith in. And they're kind of being, like you said, incentivized by other motives. They're being indoctrinated to never question the kind of mainstream ideologies.
In all fairness to them, like they're doing 80-hour weeks of just patients. They read the abstracts at best, if not just the titles.
I would be surprised if they even do that.
Yeah,
but like you're basically, they're just doing what they're told. They're not really thinking that hard about it. They're just like, this is the protocol that I was told to give.
This is what the CDC tells you.
Exactly.
This is what
I'm just
the
following
pharma partner told me. This is, this drug is recommended for this.
For us to think that they've gone through this like in-depth critical analysis of whether or not this is safe or not, that's a fallacy.
Right, yeah. They're trusting something else. Whether or not they verified it, probably not.
Ironically, they're trusting people that are more akin to you and I, but because, we've done research. But in any case, it is kind of interesting. Another side note that I'll just mention is that for the first time in my life, more recently, it's relevant because of COVID and things like that, I've actually have had a couple upfront, transparent conversations with physicians. And this doesn't have to do much with the autism thing, but just asking them, hey, in my situation, what would you do about taking a vaccine? And some of them have admitted to me that no, I don't think it's in your best interest. And that was interesting to me because that was the first time that someone went out of their way to be like, if I were you, I wouldn't risk it. Opposed to hell or high water, you need to get this. It's the only way. And I appreciated that. And they gave me a justification for it. And we had a conversation, an actual conversation where questions were asked and answered. And I came away, with the decision still to make on my own, but with at least what felt like a pretty objective kind of viewpoint from the physician that wasn't being jaded by some ulterior motive. But it's just interesting to me that we're still dealing with kind of this trust imbalance, so to speak, within the medical profession. We probably always will at some degree.
Yeah, well, I mean, it comes down to conflict of interest, whether it's monetarily or just ego-driven.
Right. And just in regard to this Wakefield, he's still out there. He still stands by his work. He's never like been like, oh yeah, you're right, you caught me. Yeah. I made up that data or I fabricated it. He stands by his work. He's adamant that it is still a valid hypothesis, and that people should be hesitant. And for what it's worth, I mean, he must believe it wholeheartedly, or else he wouldn't keep doing it. And what's interesting is we were also discussing this kind of off the air before. When you look at his hypothesis alone and take away all the scrutiny, the statistical analysis, all the controversy, and you just look at the hypothesis. Just to remind you, it basically came down to the fact that there's some sort of correlation between gut inflammation, the development of autism, and that being derived from the vaccine that was given to these children. What I find interesting is that in more recent years, I want to say in the last 5, maybe more years, there's been a lot more research that has gone into the understanding of the human gut microbiome.
Right, yeah, there's a lot that's coming out on that.
Yeah, and how that can affect things well outside of your gut and your intestinal tract, and in fact, far withstanding repercussions to other major body systems, including the brain,
right,
and your the development of certain neurological disorders. In fact, there's numerous papers that are looking into the correlation between inflammation in the gut and the development of various neurological diseases, including Alzheimer's, Parkinson's, multiple sclerosis. And so the fact that he had this hypothesis, 25 plus years ago, that in a way kind of made a similar link, that now no one's kind of debating that this is a causal thing with the gut microbiome.
Yeah, the gut microbiome, and it's been shown that it emits neurotransmitters like serotonin to the brain.
Yeah, so there's a direct link and pathway even, and so no one's going at these guys coming out with this new research and saying, "Oh, you're crazy."
Yeah,
that's fabricated. Granted, maybe, presumably, their methods are much easier to validate.
Yeah.
Sure, but if you just look at that, I thought that was interesting. It's not necessarily the hypothesis that people had an issue with per se. Maybe it is, maybe it isn't.
Well, I think it's the hypothesis of vaccines, and
I guess that's the thing, though. The second you put vaccine in it, people are like, "Whoa, that's crazy." Yeah, but when you just look at inflammation,
if you cut out the vaccine thing and then do gut health to autism or just gut health to mental health, there's a direct link to that.
And so, why is it that the only issue people had was that it was the vaccine? I feel like there's a little bit of bias there.
It could be that extra added layer of vaccine really had nothing to do with it, but it doesn't.
Could be coincidental, sure.
Right, doesn't warrant that we shouldn't look into gut and mental health or just diseases in general, because it could be that these children that did develop they could have been genetically predisposed to having gut issues that led to the autism, vaccine or not vaccine related.
And it could also be that the vaccine made that worse in some way.
Yeah, yeah.
And I don't think that hypothesis alone is that crazy.
No.
Even though they maybe haven't been able to validate it, but it seems like there's too much precedent there to completely poo-poo on it,
Right, and at least part of the hypothesis is good, like the gut health and overall health is something that I don't think was necessarily looked into.
They're seeing links too. This was more recent with COVID, but people with gastrointestinal issues following COVID infection were more inclined to have neurological symptoms post-COVID. And so, again, another kind of not the same, but I'm just looking at kind of general patterns. There's very likely some gut inflammation going on during that infection that is maybe related to those neurological symptoms that people are having. And so it just goes to say that, like, I don't think that this guy's hypothesis was completely out of nowhere.
His methods might and probably are faulty, but he could have manipulated the data to fit the hypothesis.
And that wouldn't be the first time.
No, definitely not.
Or the last. But it was just kind of an interesting side note. I'm like, oh, well, when you look at it retrospectively through what we now know and kind of consider to be the up-and-coming knowledge, it was ahead of its time in a way, like to look for those kind of correlations perhaps. But I don't know. I don't know if I'll ever be 100% convinced that this paper was like useless and complete trash. I think that, yes, it is an example that we should all kind of look at as, you know, don't just blatantly trust everything you read, even if
it's like things people say. It's like you really do have to verify it. We've gone through, even could be something, whether it's as complicated as taking a vaccine or just like, if you're gonna base any life decision, you have to like verify these things. Some people, even the stuff that we're talking about, we can get wrong and probably have gotten at least something wrong.
Absolutely.
It's like you can't. It's so much easier to just trust somebody when they say, "Hey, don't do this," or "You'll be okay doing this." Yeah. But it's not like 100%. And the way that the brain encodes memories, like they can be 100% honest with you, saying that, hey, I remember, and this is the way that it is.
Could be a false memory.
Yeah, it could be a false memory, and it's like it's not even them. They're not even malicious. It's just like their brain encoded a memory incorrectly.
Yeah, and I mean, like, this is a whole nother episode worth, but I bring up this example when I'm teaching introductory chemistry. I'm like, how does chemistry affect your everyday life, right? And I'm like, okay, let me ask you something. When you go into a grocery store and you pull that bottle of shampoo off the shelf, have you ever in your life actually turned it around and looked at the ingredients?
I have, but I have no idea what those things do.
Well, I actually, a couple times, just because I'm a nerd, I went through and looked at every single ingredient because I was curious. I was like, some of these I recognize and I could probably come up with why they're in there, but I don't know if they've been tested.
Do you ever read the ones that say aqua instead of water?
No, but there's certain ingredients where I'm like, that's not a real thing.
Yeah,
you're just trying to sell me some bullshit.
Yeah.
But like, I went through one of my shampoos one time and there was like 20 ingredients, and I went on Wikipedia and I was like, what does this do? Okay, this is a solubilizer, this is a whatever, a detergent. And the truth is, no one in their right mind really does that, because we have been kind of
right. Well, we're like chemically focused, though. Right. We got our PhDs in chemistry.
We've been conditioned
we're interested in.
Yeah, we've been conditioned as a society, though, to just be like, well, it's on the shelf. There's no way it could be dangerous.
Yeah, I got other shit to worry about.
Right, and so you're not going to go vet it that heavily. And even if you did, are you going to, like, we don't know dosages, or like, how is that going to affect you after using that shampoo one time, or
is it slowly
50
killing
years?
You?
There's no data in the world that's going to be able to tell you that. Yeah. There's not enough scientists to perform enough experiments to tell you that everything's 100% safe.
Right, because there's more new products being introduced every day than there are people or tests to vet them.
Right. And so it's kind of like, just going back that it's very common for us to just blatantly trust products, blatantly trust doctors, and not question things. But I think healthy amount of skepticism is kind of the way to go.
Yeah. It's anytime. I feel like all the issues in my life is because I trusted and did not verify.
I'm telling you, we're gonna make.
It's like, especially if you're like a responsible, other than like stupid mistakes. Like if you're sober and you did your due diligence, it's because you trusted the wrong person.
Or the wrong information.
Yeah.
As long as you're sober, yeah.
Well, I mean, there's a lot of mistakes you do when you're drunk.
That's true. But I don't know. It's like what they call it, broken record, beating a dead horse. You know, but it is really true. Like, you have to. Sometimes it's very unpleasant to have to think twice about things. It's easier to just go with it. But
yeah, I feel like you're becoming, or at least we are becoming more aware of, like, the BS stipulations around things, whether or not it's the incentives for physicians to give you drugs or vaccines or whatever, to employers paying you the least amount or giving you bonuses the least amount based off of after-tax income instead of before-tax income. And it's just like,
you're not mad about that, right?
No, I'm not mad about it. I'm just like flabbergasted of, like, it really is about, in certain ways, maximizing however much money we can squeeze out of this thing and put it into a gray area. Let's do it. If I can make however much more money and then somewhat lie to these people, or just not lie to them, but, like,
not tell them the whole truth.
Yeah, lead them to believe. It's like, lead them to believe something. It's kind of like college in general. Oh, you're going to get $100,000 salary, after this 4-year degree, and it's like, I'm lucky to make 50. And be like, oh, well, you get a Ph.D., you make $150K. I'm like,
I'm still making 50.
It's like, you're letting people believe what they want to believe.
Yeah.
And it is manipulation, I feel like, at the end of the day, because you're not being totally honest. You're not speaking the full truth.
Like we said before, people manipulate and lie for their benefit, and it doesn't matter whether you're a scientist, a doctor that's publishing in the Lancet,
or a fucking hobo that says he needs money for food.
True.
When he's going around the corner to get crack or some alcohol. He's not telling you the whole truth.
Yeah. Anyway, it's a complex thing. This isn't to say that all doctors are bad, but Wakefield may have had his reasons, just as many others have their reasons.
Yeah.
They're monetarily
Be
inclined.
skeptical.
Yeah. Ask questions. And maybe...
And they should be able to give you, like, common sense answers rather than just, like, brushing you off.
Right. Maybe not just always trust the quote-unquote science. Ask yourself, well, what is the science? Yeah. And where did it come from? And
I hope you have the time to do that, because it does take time. Like, even something as simple as anything, almost, like health insurance wise. Well, I feel like everything medical takes hours and hours of research.
Well, I think that the hard part too is going through all the bullshit. I mean, if you looked up this topic, for example, and you went to, like, say, YouTube, which is probably where you're listening to us on, there's like 500 million videos.
Right, this one's an hour long.
So from physicians to just Joe Blow sitting on their couch like us.
Yeah.
Talking about, do these things cause autism? And like 99% of them say no. And they're like, I'm a physician. And I say it doesn't. We did these studies. It sounds very official. And you're like, okay, case closed. But if you look hard enough, you will find people who have data that suggests maybe an alternative. And it's hard.
You have to vet that data, though.
You have to vet that data just as much. Yeah.
Right, and with Wakefield, it could have fudged the numbers.
Every side has a motive in this, but it takes work. It's not easy, and I think it is kind of, in a way, overwhelming to try to sort through the bullshit.
Yeah. But I feel like this generation, or at least our generation, might be questioning things more, especially after COVID, because no matter what side you were on, you were lied to. Yeah,
and I think people wanted to, like, pretend for a very long time, like, no,
because it definitely did not stop the virus. It did not stop transmission, and so at least those two things were lies, amongst other things. We'll
get into that further, yeah. But, like, there's definitely, and it's not just vaccines, right? There was other things, like the whole, hey, if you stand 6 feet apart, that's going to prevent you from getting. That's completely bonkers.
It's voodoo science.
Like that. Like they've even mostly come out and admitted that really didn't have any good positive effect.
Yeah, I think I was reading that was based on of some other respiratory disease that transmission was like much less at 6 feet. But then at the same time, I think it was, what's the super bad virus? Not tetanus.
You're talking about tuberculosis?
Yeah, tuberculosis. There's been studies where like people transmitted tuberculosis in a stadium thousands of feet apart.
I mean,
It's crazy.
So tuberculosis is actually like a bacterial infection, but still respiratory.
Okay.
And so
Not a virus.
it's still the same kind of concept of transmission. It's, droplets. But yeah, like
thousands of feet.
They found the same thing like in COVID. If you're in the same room, basically, you're liable because air circulation, the way things work. But the point being, like, sometimes there's scientific consensus that this is the thing to do. And then, like, whether it's 3 months later, a year later, or 10 years later, people go, oh, actually, that wasn't right. And we're just kind of, we have the luxury of going back, hindsight 2020, and cherry picking and making it sound like a bunch of trash, which is kind of fun, but not necessarily completely valid. I mean, there's plenty of times where science was right,
Yeah, but there's also trends that you should have known, in which it's like most viruses mutate into more transmittable, less deadly, which COVID did.
Mm-hmm.
Most viruses, if they don't affect like healthy aged people, they're not super deadly, which COVID wasn't. And then just to think that like it shut down the world and the economy.
Oh yeah,
it's way too conspiratorial to think of like why that happened, but it's ridiculous because it did.
Yeah.
Just who runs the world? Just ask yourself, I guess.
Well, that's well above our pay grade.
We'll learn someday, hopefully.
In the amount of time that we have. I guess that leads us to, I think it's probably, we'll kind of wrap it up. This isn't the last you'll hear of us talking about kind of this correlation between, vaccines and maybe autism. There's a couple other kind of hypotheses about that, including various contaminants that thimerosal, which is like a mercury-based compound that was in many vaccines until the early 2000s. We'll get into that. Some of the things that are more commonly talked about by Robert Kennedy Jr.
But also things such as like the aging population, more and more people that are having kids are older and older.
Sure. There's a lot of other potential things in our environment that we're exposed to that
different
could
chemicals.
Also be causing that just as well.
PFAs.
Glyphosate, PFAs.
Glyphosate. Shrinking of the taint. It's rough out there.
We might have to bleep that one.
No, dude, that's a legit thing. That's a legit thing, dude. It's like
show me the data.
I'll send you the paper, man. Joe Rogan. I heard it.
But this isn't just a one-sided thing. There's actually multiple facets of this, and it's still ongoing in that regard. People are still arguing about next generation vaccines with other adjuvants and additives that are thought to potentially still cause neurological complications, including the use of now aluminum in many vaccines. So it's an interesting topic, and we'll talk more in that regard, some of the papers and data and trends in research. But I don't know. It opened my eyes up to a lot.
Phthalates, not PFAs.
Phthalates, yeah.
Certain chemicals.
Well, PFAs can also, that's another episode for you, but they can also have a lot of problems. But
phthalates and shrinking of the taints.
Yeah.
My bad. See, memory. It's a hell of a thing.
It's a hell of a thing. Well, without much, you got any more to just close on other than that?
Verify as much as you can, as much time that you can put into
it's not lost time. You're investing in presumably your health, which is the most valuable resource you have.
Yeah.
So, trust, but verify the science. I'm Dr. D.
And I'm Dr. B.
And thanks for joining us. Join us again next time.